Now our next lecturer will be Stefano Bonassi from San Raffaele.
Thank you very much, Marco. Good morning. Are you ready? The idea is just to provide you some useful information that you can use when you think about how to design the study for your PBL experiment. In a way, if you think to the path from exposure or from a genetically favorable environment to the disease, there is a number of steps. You can, obviously now, especially now that there are the omics, high throughput approaches, you can have a lot of information and you can understand each pieces of this road. But the real point is that there are a number of steps which are important, because if you have an increase of DNA damage, then there is an increased risk of disease. And then this is exactly what we are interested in. In humans, this is obviously for occupational health, for the environmental health, for the early diagnosis, but also into the environment. And obviously the idea that we can use animals as just to measure the presence of exposure, or if we care a little bit about animals, we can think about preventing the diseases. And so it's the same for humans in a way. We want to explore, to investigate DNA damage and to try to understand how to prevent this kind of exposure. And the first part of the lessons is about study design. And this is exactly what you have to do. What you have to do if you plan a study on humans, as well as if you plan a study on animals. And the study design is the general plan of what you want to do. You have to set and test the hypothesis, obviously, and you have to design the way you want to test this hypothesis. That's very simple. And obviously there is a number of different study design. You can apply in the same situation different study design. So the ability is to understand what is the most efficient, what is the most suitable study design. If you talk about the investigation sequence, actually, there is a lot of possible studies. And you see here that there is a number of blue boxes in which you talk about studies which are defined without control. And actually in ecotoxicology, for instance, they are very popular. They are a kind of design very common, because you have just to, now we go into more detail, talking about case report, case series, or descriptive epidemiology, talking about geography or time trend. Then there are, in the red boxes, other studies in which may be interventional, like clinical trials. That may be the case in some cases to environmental research, but not always, or observational ones, in which the difference obviously is that here you change the environment, you observe what happens after changing the environment. Here you just observe what's going on. And then there are experimental laboratory studies and so on. This is quite providing a general overview. Talking about the uncontrolled studies, this is really useful to generate hypotheses. And when we talk about case report, for instance, this is an example of a person, but the same could be applied to a lake, to an animal, to a situation, a condition of exposure, in which you describe in detail what's happening. And the point is that generally what is happening is not common Because obviously, if I describe the flu, everybody knows the symptoms. But if I describe a very special symptoms, if I observe, I don't know, an animal with very particular behavior or particular conditions, I want to describe that. So it's really the very first step in generating hypotheses. And the second point is when I have observed, for instance, one animal with particular features, I say, okay, are there other animals like that? Or are there any other persons like that? And so I try to collect all the persons like that, all the animals like that, and I try to describe the characteristics of this group. And this is an example for humans, but is when there was the AIDS, the very first 1,000 cases were just collected and described. And just without controls, just with describing what was, for instance, the presence or complication and the etiology of AIDS, most of the epidemiology of AIDS was revealed. So what are the risk factors? Sex, HIV drug users. What was the complication? Was sarcoma, Kaposi sarcoma of pneumonia. So just case series is very useful approach. I recommend you that if you have, for instance, animals which are suffering something special, collect several animals which present the symptoms and describe the symptoms. You can improve, you remember, case report just to generate the hypothesis, case series to consolidate, to strengthen this hypothesis. And this is mostly for humans, but however, maybe the case also for ecotoxicology, in which you describe data you have, not just counting the presence of symptoms, but try to describe the symptoms according to the geographic distribution. You may have some lake or some pond which are more damaging than other, or you can have people with different areas. I mean, you know, and to see different areas with different risk, it's very important because you can associate the characteristics of one area to the risk of the disease or to the risk of the symptom. Another issue is the time trend. Oh, this is, for instance, what the mortality for asthma that was very stable in countries like Sweden, USA, but these are the ages in the 60s, when in UK, in London, there was a lot of, they use wood and coke for burning. So there was a lot of pollution with particulate. So there was an increasing of asthma mortality for asthma, and that disappeared when people, when the country progressively moved to gas. And so just to observing the distribution of cases, of diseases, of symptoms, or the trend of symptoms is very, very informative. You can get a lot of information from them. Little more difficult with animal, more suitable for humans, are control studies. I just give you a short overview of observational studies, which are easier to design and easier to evaluate. Observational studies are studies in which there is no intervention by the investigator. We just observe, for instance, how many animals lives in particular area, and the distribution of the animals is not driven by the researcher, by the investigator. Is the investigator just observe what's going on, and okay. And when there are three main study design here, one is cross-sectional studies. Cross-sectional is very popular approach in humans, but also in ecotoxicology, in which what it means, record observation in a selected group at a single spot, a single point in time. So that is, there is not, people or animals are not followed up in the time. We just go, today I go to the lake and I take, and I measure the pollution and I take the fishes in the same time, which is very good because you don't have to wait a lot of time. That's very quick. But obviously there are problems which are, I mean, this is the study design, more or less. You have a study population, and at the same time, you take the people with the disease or the outcome and the risk factor, and you link all of them together. The real problem is the tempo, I mean, you observe an association between the two conditions, but you are not sure that one is responsible for the other. There is one effect which is called reverse causality, that in this case the disease causes a condition. And obviously, if you look at exposure, for instance, or pollution, in this case, it's very good because generally you can observe an effect of pollution. Other studies are the cohort study, in which, I mean, it's the most robust study design because it's really robust versus biases. The idea is that today you take a population, you remove all people with the disease, then you classify people exposed, non-exposed, and then you start observation. If you are looking for a disease with a long latency, it may take years. If you want to observe just a quick symptoms, can take hours. So, but this is really the study design in which you divide the groups by exposed and unexposed, and you follow them up in the time. This can be done for humans as well as animals. And case control studies, which is the last study design, is vice versa. In this case, you start from the disease, you classify people with the disease, and you generally interview people to understand. This is just mostly for people because you need a questionnaire to understand the people with the disease, what was their exposure, and you can link the presence of exposure to the presence of disease. This is, I wanted just to give you a brief overview of main study design, because in your discussion, especially those in the group that can intervene, can do something actually for the protection of an environment or to understanding the effect of a polluted environment, you need also this kind of approaches. Working with biomarkers is a little more complicated because the biomarkers, you know, and there will be, I mean, Roger explaining very well this approach. However, biomarkers has a number of limitations. The main is the variability, or in which for a single animal or for a single person, you can have really a large variability. You cannot completely understand the mechanism. I mean, the stability over time. So there's been a number of design, which are called smart design, and actually that are specifically designed for the use of biomarkers. But we don't talk about that today, especially because you want to have the opportunity to use this smart design in animals. There are some specific study design which has been developed for the study on animals. And for instance, the study that I'm going to present you are a kind of study that has been developed in zoology, but has been also used in epidemiology. The idea is that when you enter into an environment, you don't know how many animals are there. If you go into the lake, you see a lot of fishes, or not a lot, I mean, you see fishes, and you don't know how many fishes are there. So the point is that, or you see birds, and how many birds are there? And you really need to know how many birds, how many fishes, how many foxes, how many animals are in one environment. So the idea is there is a very specific study design just to estimate this point, which is called capture and recapture. So there are a number of different methods. What is really important to understand first is if you are studying a closed population or an open population. A closed population is that area in which the number of animals remains the same, because there is no change, I mean, for a number of reasons that I will tell you now. Instead, open population is a population in which individuals and new individuals enter, so live, so it's much more difficult to make an estimate. And no, the idea, there is a number of different reasons for which you can have an open or closed population. In general, if there are natural barriers in an environment, for instance, if there are frogs that cannot leave a lake or a pond, or the philopatry. I mean, I didn't know what is philopatry. It's the tendency of animals to stay in that specific area, or very large area in which it's difficult to leave the area. Because, or other possible is that there are slow reproductive death rates, so animals live a lot. So there are no brief changes in brief time, or there is a short time between surveys in which there's very short times and no changes actually. So what is how does it work, capture and recapture? You have to capture the animals, and so we need two surveys. The first is you catch as many animals as you can, and you mark all of them. You can put a ring, you can, I mean, there are different ways of marking the animals. Then you return the animal to the population. So you leave a reasonable amount of time, and then you make another capture, which is called the recapture. And so you get animals, and you count out of the animals that you have recaptured, how many were captured the first time. So the idea is that you have a number of animals, you do the survey, you take some animal, you return the animal to the environment, and then you take another environment, another capture. You count the animals, and then you have exactly what you need. You need the idea is that these proportions are pretty much the same. I mean, n is the number of animals taken the first time out of n. N is the total number of animals present into the environment that you don't know. And R and C are the animals that you take the second time out of the animal that were marked out of the animal that you take the second, the recapture. Next step, obviously, is a little mathematics to reach n, which is the value that we want to know. And based on that, okay, there are some mathematical issues, like to avoid 0, you add the 1 point to each, and you get a number. So this may be, for instance, something that may be useful for your approach. I mean, if you want to design a study, you want to see how many fishes are in this pond or in this lake, I don't know. And this is a kind of approach which is a sort of epidemiology, for animals. And you have to pay attention before just to say, okay, there are 45 animals or 42 fishes. You have to pay attention that the population is not closed. You have to pay attention that the animals which are marked are more easily trapped. So maybe that if you take a fish, you make some damage to the fish, which is a little more less reactive, is easier to be trapped. So this is a bias. Or you kill the animal because the trauma of taking the animals, or you put the ring and the ring fall off. So there is a number of issues that can be taken into consideration. And the last couple of slides is just to say that this is the part in which you design a study, and you put your population in the best way to be studied. Then when you have data, what do you do with data? So you need some basic statistics. And obviously, I don't have time to give a course on statistics. However, I wanted just to focus on a couple of issues. When we talk about statistics, a very important division is in between descriptive statistics and inferential statistics. Descriptive statistics, that what I just briefly to anticipate something, is just to describe what is happening and to see what are the distribution on the animals or the persons, what is the shape of the distribution, what is the best measure to identify a feature, and so on. The inferential is when you want to compare in groups, and obviously it's much more complicated because you need to. The general idea is that in descriptive you have to generate an hypothesis. You have to generate an hypothesis. So may be very good for you. I mean, at this point, inferential, when you know already what is your hypothesis, and you want to test this hypothesis. For instance, you take a group of animals which are exposed and a group of animals which are not exposed, and you want to compare a specific symptoms or a specific behavior, and you want to test it. And when we talk about descriptive statistics, there is analytical methods and graphical methods. Graphical methods may be fine. You can use histograms, pie graphs, lines, bar. There is a number of different tools that you can use, and I recommend you to use it because descriptive statistics represented with graphical tools are very informative. And as regards the analytical methods, there is a number of issues like the measures of positions, that could be the measures of spread, and the measure of shape, the shape of the distribution. And again, you have to decide what is the measure that you want to use to represent your data. For instance, when you want to put together maybe how many animals have these symptoms, and you can use the mean. But if this animal has very variable measures or the distribution is very asymmetric, in this case, the median may be more indicated. And in some cases, also the MODA the mode can be used in which is the most frequent result. Another important measure that you have to use when you make the mean, for instance, is the standard deviation. There are not only the standard deviation, there is a number of measures of spread in which you have a mean value, and obviously you can have a very large spread, that means a large variability, or it's very narrow. It depends upon the variability of measures around the mean. You have to take into consideration that. And finally is the distribution, in which this is important not only because if you have a normal distribution, you can use a specific statistical testing, but also because maybe informative to see the distribution of the values. For instance, if you look at many biomarkers, or even in clinics, things about cholesterol, glycemia, you have a distribution more or less normal, then you have people with familial hypercholesterolemia, for instance, or you have diabetic people with very high. So generally, there is a tendency for biological measure to have a asymmetry towards the right. And you see that when you have this kind of asymmetry, you have to pay attention. Maybe there are two different kinds of population, and furthermore, in this case, to have the median maybe more robust to identify the central tendency of data. I know that this is really half an hour. But I believe that what I wanted to do is to give you some basic information about, especially study design, because if you start exploring the situation into the environment, you have to make a plan of what how you want to move, what you want to investigate, what kind of disease, what kind of symptoms, and how to measure. And then you have to take into consideration these issues.